You have been asked to come to nuclear medicine to be treated for a condition called hyperthyroidism. This condition can be treated using radioactive iodine. When you eat, your body absorbs iodine from the food. The thyroid gland then picks up the iodine to make hormones. Radioactive iodine is picked up in the same manner as the iodine in your diet. This radioactive iodine then destroys the hyperactive thyroid cells. In order for the drink to be effective, you should not have had anything to eat or drink for at least 4 hours prior to your appointment. A consent form must be signed prior to this procedure indicating you understand what is going to be done. A bib will be placed around your neck to prevent any droplets of radioactivity from spilling onto your clothing. The drink is about 1 teaspoonful of solution and tastes like bitter almonds. You will be asked to drink the solution through a straw. The technologist will rinse the container several times with water. Please try to slurp all the solution from the container to make sure that you get the entire dose. The technologist will provide you with a glass of water. Drink all the water provided and swish the water around in your mouth to make sure all the medication gets rinsed out of your mouth and into your stomach. Use the bib to dab your mouth after the drink is finished. After you have been given the medication, we recommend that you refrain from eating or drinking for 1.5 to 2 hours to ensure that the drink has been completely absorbed and had sufficient time to reach the thyroid gland. After the 2-hour period, you are allowed to eat and drink as you normally would. Until your body has finished expelling the radioactive iodine, the radioactive isotope will be found in your urine, feces, and saliva. Because of this, you must follow these guidelines. Drink 6 to 8 glasses of fluid each day. You may drink anything you like. Drinking lots of fluids washes the excess radioactivity out of your body through your kidneys. Flush the toilet 2 or 3 times every time you go to the bathroom. Wash your hands after you go to the bathroom to remove any urine that may have contacted your hands. For men, it is recommended that you sit down when you urinate in order to avoid droplets of urine from splashing onto the floor. Use plastic forks, knives, and spoons, and disposable cups for drinking, since the saliva will also contain radioiodine. Discard the disposable utensils into the garbage after use. If you must use non-disposable utensils, wash them separately from those that the family uses. If possible, let others prepare the meals. If you must handle food or prepare meals for others after the treatment, wash your hands frequently. It is not recommended that you wear latex or rubber gloves, as gloves promote sweating and the radioiodine will come out in the sweat. Part of the radiation from radioiodine behaves like X-rays and can be detected outside your body. In order to reduce the exposure of this radiation to others, it is recommended that you keep a distance of 1 meter or 3 feet from those people that you spend a prolonged period of time with, such as your friends and family. For this reason, you should sleep alone for 5 days. Casual contact with people for short periods of time is permissible. For example, a hug is fine. However, kissing must be avoided due to radioactivity in the saliva. At the end of 5 days, wash your bed linens and clothing in the washing machine as you normally would. There are some longer-term safety measures that should be noted. All women who have the potential of becoming pregnant should be tested for pregnancy 1 to 3 days before the treatment. We will need the result of the test before we can give you the drink. After the treatment is given, it is recommended that you avoid pregnancy for 6 months. For men who have been treated with radioiodine, it is recommended that condoms be used for 2 months. If you are currently breastfeeding a child, you will not be able to resume breastfeeding after this treatment. It is possible that you may experience some side effects with this treatment. These side effects are uncommon, but it is important that you are aware of them. You may experience some swelling and discomfort in your neck. An anti-inflammatory such as ibuprofen, Advil, or Motrin will help reduce the swelling and pain. If you are not able to take this medication, you can take a pain reliever such as Tylenol. Since the radioiodine is destroying cells containing thyroid hormone, it is possible that these cells may release hormone at the same time. This may result in symptoms such as an increase in heart rate, tremors, and other symptoms similar to those of hyperthyroidism. This might occur in the first week after treatment, and the symptoms may last for an additional week. You may already be taking a drug known as a beta blocker to reduce or prevent these symptoms from occurring. Contact your doctor if you experience these symptoms and find them intolerable. You will start to notice a gradual improvement in your symptoms 2 to 3 weeks after this treatment. Your doctor will likely request a follow-up appointment with you in a few months' time. To review, do not eat or drink for 1.5 to 2 hours after the treatment. For 5 days, drink lots of fluids, flush the toilet 2 times every time you go to the bathroom, wash your hands frequently, sleep alone, and keep your distance from family and friends for a period of 5 days.